Recording in. Okay, slideshow. Hold on. Okay. Okay, so this topic came by request from one of our attendee, a regular attendee. So we're gonna be sharing this. So nursing home, selecting the right one, advocating for residents, guide to nursing homes. So I'm gonna just sort of read, and as we go through, if any one of you have any kind of experiences regarding this, you can just share your thoughts. But you know what we do on this platform, we'll learn together. So choosing a loving home for a loved one can be a daunting task because it's always a period that is filled with a lot of emotions, whether it's something you have pre-planned or something that happens suddenly, and you have to have your loved one in a nursing home. Traditionally, sometimes they call the rehab center also a nursing home, and we'll go over some of the differences. So experts say that you should just break it down, begin with deciding whether the nursing home is the right fit or whether this is the right time. So it's also some people want the leave. Hold on 1 second. Someone is coming in. Let me see if I can go back. I need to go to the previous one. Welcome. Okay. Dr. Koenig, you can help me let them in. So I don't know, as I click to let them in, it's moving the slides. Okay. So some seniors may be better off home-based or community-based, housekeeping or meal service or adult day program, for instance. So some adults may benefit, they can still stay at home, but they need that connection, that human relation. Housing for those 55 and up will provide the setting for a senior that may need to live independently without much extra care. So it all depends on where the level of the person's independence, the ability for them to do their activity of daily living, that will determine what kind of nursing home are we looking at. Assisted living facility with meals and a la carte health services may also provide enough care for someone that just need like a minor help. Once health condition calls for a full nursing home, the length of stay will help determine where to start your research. For example, if somebody suddenly falls ill, maybe somebody have a stroke suddenly, or they have a procedure and they need to be placed in a rehab or a nursing home. So the doctor or the discharging group will have an hospital, we have an idea of how long this person may be staying at the nursing home or at the rehab center. Then that would determine the kind of facility. And the good thing is in the hospital before discharge, there are social workers that will sort of guide you and sort of give you different options. But it's still important for you to ask questions because you know people are individuals and not everyone always try to do their due diligence in giving all of the details. So if you're not sure, there's nothing like a silly question. If you're being told certain thing that doesn't make sense to you or that is not clear to you, let them break it down. If you're searching for a rehabilitation or a post-acute care for a stroke or broken hip after a hospital, you'll be looking at a different set of criteria than someone that is going for a long-term stay that have not just for rehab, but they're actually going transitioning from living at home because, let's say, for example, because of dementia or because of any other long-term disability that not going to be cared for at home, or they don't have anyone to care for them at home, and this is a long-term stay. So what you're looking for is going to be different because of, for example, if you're taking an individual, a family member to a rehab center because of a broken hip, you want to make sure that is a place where they do therapy often, you know. So all that dynamic is very important. As we go on in the slide, you're going to see some of the things that you need to do to be able to get to that. Families seeking top facility for such post-acute care should first visit the Center of Medicare and Medicaid Services Care Compare website. So there is a website that you can go to compare the services. And this is all based on the insurance that you have, or most people at that age have Medicare or Medicaid. So those receiving more Medicare are likely to specialize in rehab with more therapies. Long-term safe decisions should be based on the wide analysis of all the quantitative data available online. So after you've researched online, you've gone to that website. If you guys want, I can share, I'll share this link with you. The quantitative data you have online that talks about the how the nursing home is, how long the nursing home has been there, the kind of people they care for, and what goes on there, mixed with the qualitative in-person information, like really going in and observing what is going on. Once you get to the point where you can't get out of bed alone, do the cook, or you can't cook, you can't dress yourself or toileting, then you need that support. How to choose the right home. Do your homework. Some information about nursing home is self-reported, in the sense that these are the nursing home that put it out themselves. It's not something that a third independent third party is putting out. It's information that the nursing home themselves are putting out there, and they can also be drawn from different algorithms that can rank the different metrics, comparing one nursing home to another, right? So it's also important that also to know that it may also come from independent inspection by audits. Also some of the things that also you have to look at when you're looking at this metrics is looking at the staffing level. How many staff do they have? What's the longevity at which the staff stays? What has the infection control rating looking like? Because number one, with the staffing, that will speak to the administrator and the environment, the culture of the nursing home. Because as you guys know, every establishment have their culture. The same thing with a nursing home, there's that culture. You want a place that has a culture of family culture and caring for the clients or the residents. Of course, also the vaccination status of the clients, the residents that live there. And one good thing to also look at is, how did this nursing home perform during the COVID-19 surge? Because that would tell us that how well are they equipped for emergency. Because that was really a time of emergency that a lot of places, not just nursing home, were not prepared for. So if there's a particular nursing home that did really well and didn't have like enormous number of infection and reinfection, and they had separation, and they had like strategies put in place to sort of curb the spread of infection, especially in the case of COVID-19. That is really a good metric to be able to determine, well, if they can really intervene during this and keep it under control, then that speaks to the intentionality, number one of them, to follow maybe basic rule and guideline that be set by CDC, and also the ability to really pay attention, infection control, and support their staff, the training, how their staff are being trained. Other independent new agencies and websites can also be helpful. However, be cautious. Searching sites, services, and they may include limited view of the home base, or whether a facility is a member of a specific organization. That means you may not find information about every nursing home in every website you go to, but you can search multiple websites and be able to see, are there reports about this particular nursing home? Are there any negative report? We live in an age where everything is on social media. If there's a nursing home that is really bad, or a rehab center, we put their name on, you may be able to see how many times they've been featured on social media. Is it for good or is it for bad? Okay, and also local aging agencies also can help to provide valuable resources that can help. Ask people you trust. If you know people in your church or in your community that have also maybe gone through that, maybe have placed their loved one or the elderly patient in a family member in nursing home, then you can depend on their actual experience of these people, and that will also help you. And I think that's what most of us do. Recommendation, word of mouth. Or which nursing home did you go to? Or which rehab center did your friend go to when they fell, and things like that. Conditions of homes change rapidly with new directors. So this is what I was alluding to earlier when I was talking about the culture of the nursing home itself. You know, even if a nursing home 10 years ago, a rehab center was good, that does not mean it's necessarily good now. If it was bad 10 years ago, that doesn't mean it's still bad. So it's always important, even after you have maybe research on the internet and you have asked people you trust and they give you the information, the next step you have to go is to actually go to this rehab center or nursing home and visit and try to observe some of the interaction that is taking place between the staff and the clients, the residents. Some of the things you could look at include what are you seeing? What are you hearing? What kind of music it's going on in the background? What kind of music are the residents just sitting in the hallway in their wheelchair or in the day room with no form of interaction or entertainment, and they're just being entertained by the television? Are there I can't remember what they call them, but people that are responsible to actually entertain and engage the residents? Do they have like a schedule, a plan? What is included in that kind of schedule? So before you place your family member in a rehab center, you have a right to sort of go and say, you know what, I want to come and observe what a day is like in this place, because this is where your family member wants to stay, whether it's for 2 months, 3 months, or whether it's for forever. So it's very important to get an understanding of what is going on. At staff level posted, how are the staff interacting with the resident? Walk by the nursing station, what kind of conversation are you hearing? Are the bell just going off the chain and the people are not paying it attention? Because remember, if the staff, they're seeing family members and they're not overly responding to the clients, just imagine what it could be like when there's nobody around. So that's something to judge by. So experts also caution for you to not be distracted by chandelier effect of the beauty, the furnitures, or the setting, because sometimes the nursing home may be so beautiful, it just created, they have good maintenance culture. That is good, but it doesn't necessarily translate into quality care. So just listen here and follow your gut instinct and what is going on. Pay attention to small details. Are residents well groomed and engaged, or do they appear comfortable? You can also ask questions. What kind of activity? I think I sort of said this earlier. If you're not, can you mute yourself, please? Can you mute yourself? Or Dr. Quinn, can you help me mute people? What kind of you can ask questions like, what kind of activities do you have? How do you arrange the outing outside? And if people want to get out in the community, a lot of, also is good to also think of a rehab center or nursing home that have like outside yard, or where they can actually, or backyard or front yard, where residents can actually go and sort of sit outside. I really don't like rehab center where the residents are stuck indoor all day. And even those that can be on the wheelchair, they just in the common room, and there's no opportunity for them to go in the garden, especially during the summer or fall when the weather is conducive for them to be outside. That's something you may want to also consider. Is there an expectation that family can visit at any time? It will be a red flag if they restrict visitor to certain hours at this point. So for you to know, is there freedom that you can come and visit anytime? After gathering all this information, you can also look at the cost. It's important to consider the cost, in what before you make your decision. advocating for residents, advocating. A nursing home resident have the right to quality and person-centered care. When you go into any nursing home or any rehab center, there's always a poster that talks about the right of the patient and gives you information of phone numbers that you could call. So they are required by federal law to provide the care, and service residents need to reach the highest level of well-being. I know sometimes they are short of professionals, but that does not mean that the level of care that the client and the resident will receive should be minimal, should be minimized, or should be reduced, or at the point where it's affecting them psychologically or how they perceive themselves. Too often residents find themselves in a situation where their rights are being violated and their needs are not being met. It is important to know the steps you can take to advocate for yourself, resident, when this happens. So part of what you can gather even as you're visiting this nursing home and rehab center is to ask questions. Or if I'm unsatisfied with the services I'm receiving, what is the what is the step, the roadmap for me to be able to file a complaint? What are the steps that I have to take? Who do I talk to first? Of course, most people would talk to the charge nurse on the floor, or they will call the nursing supervisor, but never be afraid to send something by email, because they should give you the email of somebody in charge, because that is very important. Because conversation at times, people, oh, we had a conversation, but I always like to document things by email. So there's a track record that I have complained about this thing twice, or I have, tried to escalate this issue once or twice. Because you are asking for the document or the number that relates to your right or the right of your family, doesn't mean you're a troublemaker. These are things that should be provided. And even when it's provided, they should explain. You can sit down with a social worker and let them walk you through, what is going on in the nursing home. This is something they should do. But more often than not, sometimes it doesn't happen. So you can ask for that. Taking some of the following initial steps, taking some of the following initial steps may be enough to see positive change in your loved one's care. But if that is not the case, then filing a formal complaint can help to escalate meaningful change. Okay. And also, it's just important to be present as much as possible. If you can visit, that always make a difference, because they know the family member are coming to visit. Escalate serious problem. If a significant problem arises, like unnoticed fall, medical issue, escalate the matter. Start with the assistant living director, director of nursing, if necessary, involve the executive director. Even when you start, before there is a problem, you want to get to know these people. When you go into the nursing home, can you give me the information of your director of nursing? Can you give me the information of who is the regular charge nurse during the day? Going a lot of rehab center, there's always like 3 shifts. Some have 2 shifts. There's a shift like 7 to 3, 3 to 11, and 11 to 7. And if it's a rehab center where they have 2 shifts, so the main person that's in charge is always the one in the morning, because they have most of the full staff there. So if it's possible, you want to come during the day, even if you can't come every time during the day, come during the day so you can meet all of the leaders in the nursing home. Let them know, oh, my mother or my husband, my friend, they just in room whatever. I would like to just meet you. Thank you for all that you do. Let the first interaction with the leaders be a pleasant one, where you're finding a way to thank them for even supporting your loved one, so that when there's an issue and you escalate it, that is not the first time you have an interaction with them. Report suspected abuse or neglect. If you suspect abuse or neglect, contact your local long-term care. I can't say that. Dr. Kona is that. Ombudsman, something like that. Agencies overseeing the long-term care facility that can investigate complaints. Very, very important. You want to put something in if you have escalated issue and you feel that your complaint are not being addressed or they continue to happen. So it's important. Take pictures. If there are injuries, you see an unsafe environment, it's okay to take pictures, especially if you want to share it with the leaders of the facility to show this is something I've already spoken to people on the floor, but they're not responding to me. Every time I come, this keeps happening. That's why I'm escalating this situation to you. Organize and advocate together if there are common problems. No, there's power in group, right? There's really power in collaboration. So if you have other residents that have family and they have the same kind of complaint, you can always come together. And on the other side, if it's a facility that's taking good care of your family member, you want to just escalate the good work that is happening, so that when the time of complaint happens, it's obvious that, okay, this person has paid attention and really spoken well when the work was done well. So if they're complaining now, there's really an issue. So this I said already, if change is not observed, it's okay to file a complaint. Do not feel bad. Do not feel like a troublemaker. If you need support, if there needs to be a change, then there needs to be a change. Okay, so this is the end of the presentation.
Good. Yes.
Can you please mute yourself if you're not speaking, please? I say if you're not speaking to us, I should say. Okay, so that's all I have to share with you today regarding the nursing home and the rehab center. The floor is open for questions, or you guys can share some of your experiences to sort of maybe collaborate what I've said, or you want to talk about something else that may not be the case from your experience. Anyone can go. You can unmute and start.
I'll start with my experience with my mom. This goes back about 5 years, maybe a little longer. This is an encouragement to anyone on the line who has someone in a nursing home, that you make sure you know the representative for your loved one, the accountant, the person taking care of their money. From what I know, the monies that come into a nursing home are from Medicare. And each person, of course, has their own Medicare account connected to the nursing home, because that's how they're getting paid. The experience I had at the very end of my mother's stay there was, and this I found out by surprise, that unless you ask for the money that's there once your loved one leaves or is deceased, they keep the money. So you should be aware that you have to request that money. And then it will be sent, I believe, directly to the funeral home or to the family, but it's not done automatically. The other thing that comes to mind was when, the nursing home that I chose, it turned out to be Highland Care, it was good at the time. I don't know how it is now, but it was good at the time. And this was pre-COVID, so there was no risk of that at the time. They took very good care of the residents there, and I chose it from a list, really at random, prayer, of course. And then I chose it because it was close to my home at the time where I was living. And I wanted to be close enough so that I could visit my mom. on whenever I needed to, and especially on the weekends. So that's how I chose it. And it turned out to be a good choice because there were several other people from the church who were there. And even one lady across the hall, um, who I remembered from church. And it was a relief to me to see her walking out of her room when my mom was right across the hall from her. So it turned out well. But I just wanted to encourage any of you on the line, especially about the funds and the account, your Medicare account that is connected to your loved one, to be sure to keep track of it. You should be getting statements at her address or his address, and stay on top of the money.
Thank you very, very much. That is really a fantastic point you raised. I wouldn't have known that. There's a little experience I have regarding that, which was there was a time I used to work in a nursing home, and I'm trying to remember the details of it. So this woman, was at the nursing home, but she was very, very wealthy, but she didn't have no children, and you could tell she was wealthy because of the kind of clothes she had in her closet, the way she carried herself, how she wants her things to be done, how she wants her room to be arranged, and then, when she passed, I just had conversation on the side, which I shouldn't have heard, talking about. So, like, if you have properties, so Medicare doesn't come in, they're gonna sell all the things you have. All your money will finish first before it start going there. So this woman lost all of her stuff, everything, and then the kind of services they will give to you. I think at times some nursing homes, some rehab center are very greedy. They had extra stuff that you may not necessarily need if you don't have money, or if Medicare is paying, because now individuals may not be paying the kind of attention, especially if they don't have family. Even those that have family don't know the questions to ask. So I think this is a valid point that you brought up. So now, if you're going in, your family member is in a rehab center or a nursing home, you can ask questions. Or can I see the accounting? How much money is in the account? So they know you know what you're saying when you bring questions like that. Can you please explain to me what's coming in and how it's looking like? And they are obligated by law to share that information. Thank you so much, Mr. Beverly, for flagging that. Great information.
You're welcome.
Any other persons? Sister Angela, do you have any experience regarding nursing home? Sister Mary?
Sorry, I'm actually in a grocery store, but I was stuck in the rain.
Ah, okay.
Have a good evening. Yeah, I just got into Target. I live in Minnesota, and it was a terrible storm over here.
Oh, no.
So, anyway, thank you. Have a good night. I'm going to stay on.
No problem. Thank you. Thank you, Sister Mary. Dr. Coney, feel free to be mute and share whatever you want to share, if you have something to share.
Well, my perspective, is from being a physician in an acute care setting, and then having to send someone to nursing home or to rehabilitation. This is my experience, my perspective is that because of the situation that goes on with hospitals, there's a push to get a patient out before they might actually be quite ready, to get out of the acute care setting into the nursing home setting. And the reason that could be an issue is because in the nursing home setting, there's a big difference in staffing in terms of the number of physicians to patients and the number of nurses actual nurses to patients and, ancillary staff to patients. So the level of care differs greatly from the acute care setting to the nursing home setting. And then the actual, like the mentality is different from the acute care setting to the nursing home setting. So in the nursing home setting, it's more laid back, so to speak, than the acute care setting. So the attitudes might be different, than the acute care setting. The level of education is definitely different because in the hospital, the majority of nurses that you meet will be registered nurses, but in the rehab setting, there may only be one or two registered nurses for, a great number of patients. And the other staff that you meet are not going to be professional staff. So the nurses in the nursing home, for example, might only be there to dispense medication, and then the patients are really being taken care of by like CNAs and other level of staffing. So when the patient gets there, after having been in a setting where there's like one registered nurse to maybe 10 patients, you get to a setting where there is like one registered nurse to maybe 50 or 60 patients. I know from the physician side, that is what it is. It's like one physician for 60 patients. And the physicians are not there the entire shift. They are required only to write notes, like maybe depends on the institution, but they're not required to write daily notes. So, with a level of staffing of one physician to like 60 patients, your loved one, or your individual might not get seen but once a week or so. So that's a big difference also. And then there is not a physician on site. There may not be a physician on site 24/7. So you might get a physician during the day shift, but in the evening and the night shift, there'll be someone on call, but not someone physically there. So, from my perspective, I'm just telling you from my my experience and my perspective. So, everything is much slower in the nursing home in terms of response to what is happening to a patient. Everything takes much, much longer. Ordering tests and lab work and other tests doesn't happen immediately because it's it's not an acute care setting. So things take much, much longer. The other thing that I would mention is that sometimes there is not much of a choice in terms of where your family member, et cetera, will go after acute care setting, because especially in New York, there's a limitation of the number of beds that are available for nursing home or for discharge after the acute care setting. And you may not have much choice in the matter because of the limitation of beds. So that's another issue that I encountered as, you know, as a physician working in this setting. So I will leave it there. I see Natasha. You have your hand up. You have a question?
And Mary have a hand up.
I don't know. Can you hear me?
Yeah.
Can everyone hear me?
Yes, we
Yeah.
can hear you,
Yes.
Natasha.
Oh,
Go ahead.
excuse the background noise. Um, I would like to reaffirm exactly what Dr. Crony is saying, and that's why so many patients end up actually dying, or in some instances where minor issues can become issues where they have to be, hospitalized, because a lot of times the doctors, though they have a lot of patients, their attitude that they would have in the hospital setting is totally different from the attitude that they have in, say, a nursing home. Um, they they have this understanding that the patient is just there, and they a lot of times just meet their status quo. A lot of times when they come in, and I've experienced it, they come in, it's like, what's up? They may not even do vitals or really look at the patient. They might just come in and have a conversation and basically write that down as as a visit, or like they did something. And in some instances, um, while they may be considered on duty, they may not even be on the premise. They may just be on call. So in a lot of instances, um, the doctors are not even necessarily there. They're just on call. I know, so there may be big gaps between when a doctor is actually, in a facility, depending on who the doctors are. And I would also say, sometimes you are limited in your choices depending on the level of care um, that the patient or your loved one has. In my instance, one of the main things you do consider is the distance when you're choosing. But the other thing is that maybe they required a special care. Like my husband is a renal patient. So when I started looking at rehabs, all of the options began to lessen, because a lot of rehabs do not have dialysis centers on the premise. So that lessens your options in terms of where you can go. I think one of the things that Dr. Sherry said in reference to emails are very important, because in many instances, when you talk to directors, though they have to listen to you, at the end of the day, um, they just want to be able to say that they met with the family, because they have to always project that they have good family relations with the patients. But in a lot of instances, if you don't follow up, they're not necessarily going to follow up and do what is necessary unless you're, consistent. Because they're like a representative in a way, even though they're directors, but not necessarily, in my situation, I found not really willing necessarily to do things, but very good in talking a good game. So I just feel like that you really do have to be present all the way through, in terms of everything. Um, and unfortunately, the nurses' aides are really, or the CNAs are really, thank you, the first people in the line front in terms of a lot of times catching things.
Yeah, 2 down.
Catching things also. And then the nurse, more so than even the doctor if something is wrong. So having good relations with the CNA, if you can, is very helpful, because they're going to be the ones to catch the bed sores and a lot of times those kind of things that can cause a lot of problems. I don't want to say anymore because I know the background is very noisy. So I'm going to get off because it's a lot going on here. Thank you. Thank you for your time.
Thank you so much, Natasha. Thank you. Bimie?
Yes, hi. I just want to say thank you so much for this presentation and webinar because I'm not too familiar with the nursing homes. My practice has mainly been acute care. And just to piggyback with Dr. Crony and Natasha said, it is a different setting based on listening to the webinar. One thing that I just wanted to ask because I'm not familiar with the nursing homes is typically in acute care in a hospital, we do have some patient relations where they advocate for patients, but it seems like it's a little bit different in the nursing homes and rehabs where the family members are the advocates. But then again, family members are not there 24/7, and some patients are alert and oriented. But yet again, who are going to be the advocates for them when the family members are not around? So I do see that could be like a gap and a challenge, and that's the reason why many things are being missed. Because typically some people will see a stigma that once a patient is in a rehab or nursing home, they don't generally take them serious of their complaints or comments. So I don't know if that's something that they have there. Maybe you can enlighten me and let me know, are there advocates there 24/7 for the patients who are in our nursing homes?
Yeah, typically not, because it's a nursing home and they consider it to be a transition between, um, the acute care setting and home, potentially home, or if that patient is going to be there long term, um, like Sherry was mentioning, if they have a stroke or something like that. So it's the mindset is completely different than the acute care setting. And as Natasha was saying, your best bet is if you have someone that can be there, because those, those individuals that have family members that are present, that show up, the staff see that, okay? And they know that, those individuals are watching. And so they typically would do better by those patients who have someone who shows up, family members, friends, whoever that show up consistently and who are interested and ask questions and and just are present. Um, and those individuals, tend to get better. I would say get better care. This is my observation, but they tend to get better care than those who, don't have that sort of support system. But the whole nursing home it's slower. Okay. I mean, when you're in the acute care setting, things are moving along, people are present, um, doctors are present all the time. Nurses, you have a level of nursing that is different, that's at a higher level. But when you get to the nursing home, you're not meeting you're not meeting that same setting. So, it's mainly going to be um, CNAs. Um, like I said, if you have a RN level nurse, they might be one nurse, for X number of patients, like 60 or so patients, maybe one every shift, and that is to dispense medications because, they're licensed to dispense medications. But they cannot function the same way as they would in the acute care setting where there would be one RN to maybe 8 to 10 patients, something, along those lines. When you're talking about one RN to 60 patients, it's a huge difference in what they can manage, and what they can see, what they can do, because they might spend the entire shift just dispensing medication. And then it's left up to the CNAs to do any, if the patient needs help with ADLs and things like that. But the mindset is totally, totally different. It's much slower. Um, you'll have a social worker during the day, but the social worker's caseload is going to be extremely high. So, they're not, um, it may not be that they're not willing, it's just that they have so much on their plate, to handle. So, you have to go in there with a different mindset, a different attitude. You have to go in there knowing that you, as the support system for your loved one, you're going to have to step up and do a lot of things that you may have expected the staff to do, but it's just not possible. And if you want your loved one to get out of the nursing home, if that's the possibility, you're going to have to take on a lot of responsibility yourself and getting things moving and getting things done. And if your loved one is going to be there for any extended period of time, then I think just showing the staff that there are people around, that, someone is there, someone is present, daily visits, or, make a schedule amongst yourselves to have someone be there. Once they see that level of interest is there, then they're going to, spend better attention to your loved one. They're not going to let your loved one stay there in a dirty diaper, because they know that, a family member or a friend or someone is coming, and they're going to notice that that diaper is dirty. So that's my experience.
Okay, thank you. Thank you
Thank
very
you so
much.
much.
Yeah, I posted something also in the chat, but you can read it. It's about the advocate, the state advocate that they have access to. But they definitely, like, they're not in the nursing home, but they have access to them. Okay, so thank you. I think it's been a great conversation tonight. The time went so fast. It's already 5 minutes to 8. Can you believe that? We've been conversing for over an hour, so close to an hour. So I just want to share this with you guys quickly. Let me move this aside. So as you guys know, COVID is on the rise. We want to encourage you to get tested if you're not doing well, and you can get test kits at a location near you in your neighborhood. They are sometimes in the library and also at the firehouse. So you can just text COVID test to 85548, and then you'll be able to, you put your zip code, and you can see where you can pick up something in your neighborhood. Okay, so that's that. So if you're not feeling well, try to stay home, take care of yourself, and wear your mask. Right, Dr. Quinn? Because this thing is around the corner, especially if you're
Yes.
going to going on the train, or you're going to be in a big crowd of places, people that you're normally not around.
Yes.
It's challenging. There's
Yes, but
another
there is a
surge
summer.
going on. There's a
Yes,
surge
there's a
going on.
summer surge.
Yep.
Yeah, the summer surge, and it's a different variant. So, you know, be wise, use wisdom.
Okay. Okay, everyone. If you don't have any questions, comments, we're gonna call it a day. And then thank you very, very much for joining us today. And remember, be safe, wash your hands, wear your mask, and encourage someone to do the same.